Welcome back, everyone. I am Dorothea Howard, the host of Let's Talk Sarcoidosis, and to my left is my co-host, Mr. Lawrence Franklin. How are you today?
I'm doing great. How are you?
I'm doing well, thank you. We have a fantastic guest on the show today, and we are ready to get started. We'd like to welcome Dr. Donald E. Thomas Jr. from Arthritis and Pain Associates of Prince George's County. Welcome, Dr. Thomas. How are you today?
I'm doing very good. Thank you, Dorothea and Larry, for having me on the show this evening.
Thank you so much.
Welcome.
We really appreciate you being here because we know that you can share a lot of expertise to our viewers. So, Dr. Thomas, what is sarcoidosis?
Sarcoidosis is oftentimes difficult to explain to patients, so I like to start with a picture.
Oh, okay. Nice.
This is a biopsy from the lung taken from a person who has sarcoidosis. This person probably presented with shortness of breath or chest pain, and so the doctor got a piece of the lung, a tiny piece, what we call it a biopsy, and then looked at it under the microscope, and this is what you would typically see. This is hundreds to thousands of white blood cells that are clustered together in what we call a granuloma.
Oh, okay.
A granuloma classically will have these cells that have a lot of nuclei in them. The nucleus is the important genetic part of the cell, and we call these giant cells that you see right here, and that's classic for a granuloma. Our bodies are amazing in that over time our immune system developed this way of fighting off certain infections by the white blood cells of the immune system clustering around the invading organisms to protect our bodies. And the granuloma was what the immune system came up with to fight against tuberculosis, fungal infections, and also even syphilis. But unfortunately, the body does not always do what it's supposed to do, and for some unknown reason, some people, their immune system will become overactive and form these granulomas in places where they should not be occurring, even though there's no active infection going on. When these granulomas become numerous and deposit inside of organs and cause those organs not to work properly, then they can end up having medical problems that can become significant. For example, in this picture, this white area here, that's actually an air sac.
Really?
And over here and over here, these are alveoli or air sacs, and this one granuloma is taking the place of probably 3 or 4 air sacs. And so if you could imagine this occurring in multiple areas of the lung and these air sacs not being present, so the person can't bring in the oxygen they need and blow out the carbon dioxide that they need, they'll become short of breath or develop chest pain or develop a cough, causing them a lot of problems.
Right.
And this can occur in other parts of the body as well, even the bones, the nerves, the joints, and the skin, and even the eyes, causing vision problems.
Wow. So these granulomas just actually just push in and just take over those areas.
Exactly. When they're so numerous that they keep the organ from working properly, that's when you develop the disease. So the bottom line is that sarcoidosis is a disease where there's too many of these granulomas occurring where they should not be occurring. They're not really protecting the body, but they end up causing damage to organs, causing medical problems in multiple organs. So as a physician, we'll call this a multi-system granulomatous disease of unknown cause. So it's multi-system because it affects a lot of different organs in many different systems of the body. It's granulomatous because it makes these granulomas where they shouldn't be occurring, and we don't know what causes it.
And that was my second question of what causes sarcoidosis.
We really don't know truly what causes sarcoidosis, Dorothea, but there's a couple of different theories out there. Number one, it could possibly be due to something environmental. For example, there's an element called beryllium that can be combined with minerals to make strong, hard metal objects, and beryllium exposure can cause a problem that looks exactly like sarcoidosis. Also, infections. There have been some studies that have shown elements that look similar to tuberculosis type organisms and even bacteria that you can find in acne inside of some of these granulomas. So it's postulated that maybe infections can cause it as well. And then lastly, there's some genetic facts that are also true, that sometimes sarcoidosis can occur and cluster in some families, and they've actually identified some genes that predispose people to having a higher risk of developing sarcoidosis.
Wow, that's something. Now, you mentioned some things in the environment that may trigger sarcoidosis. Can you give us some additional examples?
Yes, one of the most recent ones would be the World Trade Center disaster. After the World Trade Center, there were thousands of rescue workers involved in the project with cleaning up the World Trade Center, and they were exposed to a lot of dust and dirt. And in the first 5 years of the World Trade Center disaster, when we look at those rescue workers, in the first year, 13 were diagnosed with sarcoidosis.
Wow.
That's 6 times higher than the expected rate of sarcoidosis in that particular number of people. You would only expect about 2 in the number of people who are working on the World Trade Center. And then for the next 4 years after, another 13 people were diagnosed with sarcoidosis. So a total of 26 within 5 years, and that's much higher than the expected rate. So we have to postulate that something in the dust, such as an element or a mineral or some type of infectious agent, triggered those people to develop sarcoidosis.
Wow.
Another example would be the National Institutes of Health. They funded a large study about 10 years ago. They had over 700 people with sarcoidosis that were studied, and interestingly, some exposures and occupations were found to be more numerous in that population than others. People who worked in agriculture, people who worked with insecticides, and people who were exposed to mildew or mold in their environment had a higher risk of developing sarcoidosis.
Wow.
So we do think that something in the environment triggers these diseases.
Wow.
Very interesting. Dr. Thomas, is sarcoid more common in some ethnic groups than in others?
Yes, unfortunately, and this probably has to do with a genetic predisposition. Unfortunately, 3 to 4 times more common in people of African descent. And also, the disease seems to have different manifestations in different ethnicities as well. For example, African Americans, unfortunately, oftentimes will have a more severe disease course with sarcoid that often lasts a lot longer and even the rest of the person's life. And then another example would be people who have ancestors from Northern Europe and especially Scandinavia. There's a particular variant of sarcoidosis called Lofgren syndrome. Lofgren syndrome is, most people who read about sarcoidosis will read about it, and classically they present with an acute, abrupt onset of illness where they'll get a fever, they'll develop some shortness of breath possibly, they'll develop red tender nodules on their skin of their legs, as well as arthritis. And this typically occurs in people of Scandinavian descent or Northern Europeans. But the interesting thing about this is that it usually goes away on its own. Even if the person were not to see a doctor, usually it goes away, which is very different than many other types of sarcoidosis.
Absolutely.
Wow.
Yes, definitely.
So, what should someone possibly look out for as a sign that he or she may have sarcoidosis?
Unlike many other diseases, we don't have a way to tell people to look out for the disease because it mimics so many other problems. For example, 75% to 90% of people with sarcoid will have lung involvement. When they have lung involvement, they'll develop either a cough or shortness of breath or chest pain. But there's so many other things that are so much more common, such as asthma, a cold, influenza, that are much more likely to cause those symptoms. It would be hard to tell someone to think of sarcoidosis if you get those symptoms. Probably one of the most common things that we talk about in the medical field is this finding right here, which we call erythema nodosum.
Looks familiar.
So you've had this before,
Looks
Dorothea.
familiar, yes.
Very common in people with sarcoidosis, like the Lofgren syndrome I just mentioned. But if you notice on this lady's leg, she has these red areas that are circled. And if you take your hand and you run your finger over it, they'd be lumpy and bumpy underneath the skin, and they'd be very tender. If I were to touch this lady's legs, they'd be very tender in those particular red spots. So erythema is the medical term for redness. Nodosum refers to nodules or nodes. So these are tender red nodes or nodules underneath the skin, especially in front of the shins and the lower legs.
Right.
And then as they heal up, they'll become bruised in appearance. And this is classic for sarcoidosis. However, many other diseases can also do this. Lupus, rheumatoid arthritis, strep throat can do it actually.
What?
And even women who take birth control pills can develop erythema nodosum. So it's
Oh my
not
goodness.
specific for sarcoid,
Right.
but whenever we see this, we always want to rule out sarcoidosis.
Wow. Jeez.
So, along with that, how is sarcoidosis diagnosed?
Sarcoidosis most often presents with lung problems or pulmonary problems. As I said, 75 to 90% of people will present with either cough, shortness of breath, or chest pain. So oftentimes they'll get a chest x-ray. That can be the first clue.
Right.
In addition, a lot of people have to get a chest x-ray like when they go in the military, get a job, get ready for surgery. And so oftentimes this is what we'll see on the chest x-ray.
Yes.
This is a chest x-ray. In the center, you should usually just have the heart and the great vessels of the lungs. But what you see here are these two very large white areas, and these are actually swollen lymph nodes. We call this hilar lymphadenopathy, and in many patients, this is one of the first things that we'll see. And when we see a chest x-ray like this, one of the very first things we think about is the possibility of sarcoid. However, other things can also do this. For
Yes.
example, lymphoma,
Yes.
cancers, tuberculosis. And so the person who has this on their chest x-ray ends up usually having to get a big workup after
Right.
that time. Most commonly, we need a biopsy, because remember, we want to look for that granuloma that we first
Right.
talked about
Right.
to give us the first clue, so the person will go get a biopsy. Hopefully, we'll be able to get a biopsy from a part of the body that's easy to access. So we'll look at the skin and see if there might be any purple or red lumps to get a biopsy, because sarcoid can affect the skin.
Right.
Or sometimes they get inflammation of the eye, like uveitis, and we might be able to find a swollen area next to the eye to get a little piece of tissue to biopsy. Sometimes the salivary glands can be affected, or the lymph nodes. We'll feel to see if there's any swollen glands in
Right.
the neck or under the armpits, because those are very easy to biopsy and
Right.
don't cause much trauma to the patient. Unfortunately, many people end up having to get a lung biopsy, and we can do that in two different ways usually. One is where the lung doctor will go down with a fiber optic scope, go down into the bronchial tubes of the lungs and get a little piece of tissue that way. It's a very easy, actually fairly easy way to get a biopsy. And if they can't do it that way, they'll make a little incision in the chest wall and get a small piece of tissue of the lung that way. But the workup does not stop there. As I mentioned before, our immune system made this in the first place to prevent us or to keep us healthy from tuberculosis, fungal infections, syphilis, things like that. So when we see this under the microscope, when the doctor looks at the tissue and sees that granuloma, the first thing we have to do is rule out tuberculosis and other
Right.
things. So we usually give a tuberculosis skin test. We'll send the tissue off for cultures, make sure there's no fungus growing in it or anything else. Then once we rule out everything else, then we could say this person has sarcoidosis.
Right.
So it's pretty critical for a person to get a biopsy, regardless of whatever their diagnosis is, just to get an accurate diagnosis of.
Yes, I agree. That's absolutely recommended and essential in the vast majority of cases, because so many other things can mimic this, to
Right.
include cancer,
Exactly.
by the way. So it's important to get that biopsy. However, there's two occasions where we don't do a biopsy, because we don't like to cut on people if we
Right.
don't have to. The person who presents with that chest x-ray with large lymph nodes in the center, if they're completely healthy, feel perfectly fine, then we assume that it's probably sarcoid, and we'll just watch them and not even biopsy them at all.
Right.
Oh,
In fact,
okay.
one half of everyone who has lung involvement from sarcoid will actually not feel bad at all and not need a biopsy. We'll just follow them over time. The other person is that person from Northern Europe who has that Lofgren syndrome. It's so classic. Hardly anything else ever causes that, so we don't get a biopsy usually in that case either.
Well, I know for me, I did have the biopsy in my neck, and I was faced with them telling me, the physician saying, well, you may have tuberculosis or you may have lymphoma. So I did have that scare. So speaking of that, how is sarcoidosis treated?
Sarcoidosis, first of all, about 50% of people with lung involvement don't even have any symptoms. So they're very fortunate we don't even treat them at all.
Oh, geez, I wish I was one of those people.
I do too.
I resemble that remark.
I was not like that.
Unfortunately, if the sarcoidosis is causing significant problems, of course we need to treat it because we don't want it to cause damage to the organ it's affecting.
Right.
So someone with lung involvement who does have shortness of breath, the person who has inflammation of the eye with trouble with vision, the person who has skin involvement where it causes cosmetic problems, it can be very disfiguring, then we do need to use treatment. And the drug of choice usually is a steroid, such as prednisone, oftentimes used in high doses.
Right.
It works miraculously in the vast majority of people because the prednisone suppresses the immune system so that those granulomas can shrink in size and allow the normal tissue of the organs to take over and start to function properly again.
Oh, okay.
Then once we get the person to start feeling better, then we start to taper down slowly on the prednisone or steroid. Because the problem with steroids is that unfortunately 100% of people will get side effects at those high doses.
Right.
And they include things such as weight gain, diabetes, high blood pressure, cataracts.
Personality change.
Personality changes.
Yes, oh my goodness.
Oh yeah, the wife or husband goes through a lot because unfortunately it does cause moodiness and depression.
My wife is probably somewhere saying amen.
Yes. So I hope your wife knows it was our fault and not your fault. In addition, when we start to taper down on the prednisone, and this is a very important point, if the sarcoid becomes more active again, then it's very important that we add another medicine to take the place of the steroid.
Okay.
There are other immune suppressant medicines like methotrexate, Arava, Imuran, and the newer medicines, which, by the way, are miraculous in my opinion, such as Remicade and Humira. They're just really godsends, that they can actually take the place of the prednisone and steroids so we can get the person down on low doses and hopefully get them off of it.
Wow. So what type of doctor usually treats patients with sarcoidosis?
Good question. Since the vast majority of patients have lung involvement, it's usually the pulmonologists who treat the majority of patients simply because they're usually the first doctor that the patient sees, and the pulmonologists see more cases of sarcoidosis than anyone else. However, rheumatologists would probably be the second most common specialty who treats it, and the reason for that is that myself as a rheumatologist, I treat a lot of systemic inflammatory diseases such as lupus and rheumatoid arthritis. So we use a lot of these immunosuppressant medicines such as prednisone and steroids, methotrexate and Imuran. In fact, we probably are more experienced with using these medicines than any other specialty. And so if an eye doctor diagnoses sarcoidosis from the eye, or a dermatologist, which is a skin doctor, diagnoses it from the skin, or a nerve specialist diagnoses it in the brain, they're not very comfortable with these medicines, and oftentimes and usually they'll send the patient to us and we'll treat the patient and we'll work in tandem with them to get the patient the right treatment. And then we monitor them very closely with the steroids, trying to get them down on the steroids, and then if we can't, add those other medications.
Right, because I know I get joint pain, you know, and I'm sure so many other patients get joint pain, so it's great to know that we have somewhere to go to.
There you go.
We definitely have somewhere to go. You're a rheumatologist, as you just mentioned, so you treat arthritis. How often do people with sarcoidosis develop arthritis from that?
Sure. About 10% of patients with sarcoidosis will develop actual inflammatory arthritis or muscle involvement or even bone involvement from their sarcoidosis. In fact, oftentimes we'll be the first person who sees the patient because of joint pain or bone pain or muscle pain or muscle weakness. So it's not a high percentage, it is 10% of patients will develop arthritis. Fortunately, it's usually not a deforming or disfiguring arthritis. It's usually reversible, which is really nice with treatment.
Oh, okay. I didn't even know that was reversible.
Yep, absolutely. The vast majority have a
Okay.
reversible arthritis. The main one that is not reversible is that sometimes the sarcoid can invade the bones. Those granulomas can invade the bone marrow and the bone and cause cystic, swollen areas inside of the bones, and those can become permanent. But that's a very, very tiny percentage of people.
Okay. Jeez.
So what is the life expectancy of someone who has sarcoidosis?
Ooh, do we really want to hear that?
Are you ready for
Go ahead,
this?
Dr. Thomas. We're ready.
Fortunately, well, not fortunately, 5% of people with sarcoidosis will unfortunately have a decreased life expectancy, and usually that is from severe lung involvement or brain involvement or even heart involvement from the sarcoidosis. So that's a sad part of sarcoidosis.
Right.
But on the flip side, that does mean that 95% of people will have a normal life expectancy.
Right.
I always like to look at the glass half
Yeah,
full.
look at that one.
And so I like to concentrate on the optimistic 95%
Right.
as
No.
having a normal life expectancy.
What can people with sarcoidosis do in order to ensure that they stay healthy as possible with sarcoidosis? Because I know this is a big one for everybody that think it's they don't have any type of life that they can have with sarcoidosis, a productive life, I must say.
Sure. Number one is education. Just
Right.
the person watching the show, that is the most important first
Yes.
step. Because if you don't know why your doctor is giving you the particular medicines and know what sarcoidosis is, you're going to be much less likely to be compliant with therapy. And then that's when people fall into the trap of possibly being that 5% that does not survive. So education is number one.
Okay.
Number two, learning how to deal with a chronic disease. Unfortunately, many people develop denial or they don't want to own their disease, for example. I hear that a lot from patients. And it's really important to learn how to accept having a chronic disease and to learn how to deal with it. They should make sure to keep all their doctor's appointments and never miss an appointment.
True.
Take the medications religiously and never miss a dose. Unfortunately, studies show that a high percentage of patients with chronic disease miss their medicines regularly, and that's the number one cause of people not doing well.
Right.
And then lastly, making sure to get all the tests done that the doctor wants them to do regularly. And then the final part is lifestyle habits. Eating a healthy diet on a regular basis is really important, and also exercising regularly.
Okay.
Exercise alone helps people deal with stress of a chronic disease much better. Sarcoidosis oftentimes does affect the heart and the lungs, and so keeping your cardiovascular system healthy is very important, and that's
Okay.
where the healthy diet can also come in. And then in addition, unfortunately, since steroids and prednisone are the number one medicine we use, most patients gain significant weight and develop sugar problems, blood pressure problems. So eating a healthy diet and exercising regularly are really paramount in trying to prevent those side effects.
Okay.
It's interesting that you mentioned the exercise, because it seems like Dr. Chen mentioned that a lot, and you seem to mention that a lot. So we want to make
We
sure
wanna
our
make sure everybody
viewers
do that, yeah.
understand that
Right.
exercise is critical. Exercise is critical.
So, Dr. Thomas, our show is almost up, and I tell you, this information is definitely valuable, and we are so grateful that you shared your expertise for all of our viewers. Is there anything that you want to tell the viewers before the end of the show?
Yes, my other take-home message is it's really important to educate yourself about diseases and disorders. For example, there's a related disorder that's oftentimes mimics sarcoidosis, and oftentimes we have to consider both diagnoses at the same time, would be lupus and sarcoid, because both of them can affect the lungs, the skin, and the joints.
Right.
And so oftentimes we'll be wondering if the person has lupus or sarcoid.
Okay.
And a lot of people don't know about these diseases and would be
Right.
better served if they knew about them. For example, a recent research study showed that in patients who were diagnosed with systemic lupus, only 15% had even ever heard of lupus as a disease.
Wow.
Wow.
Yet lupus is more common
Right.
than muscular dystrophy,
Wow.
cystic fibrosis,
Okay.
leukemia, and also the myotonic dystrophies as well,
Right.
all combined.
Okay.
Yet the vast majority of people have heard of leukemia and cystic fibrosis and muscular dystrophy. So we really need to educate the public so that they
Yes.
can hopefully give more money also to charities so that
Right.
we can do more research and try to find a cure for these diseases in the near
Right.
future.
No, I definitely agree. And I tell you, we definitely will have to have you back again.
Absolutely, yes,
So
we will.
can keep talking
Yeah.
about the different similarities as far as, sarcoidosis and lupus and other things that are related. And as we both say, we both have sarcoidosis, but sarcoidosis doesn't have us. Until next time, be blessed. Thank you
Thank
for
you.
watching. Thank you so much, Dr.
Thank you.
Thomas. We really appreciate it.